Good evening and welcome to the 5th Annual National Empowered to Serve Accelerator. I'm Nancy Brown, Chief Executive Officer of the American Heart Association, and I'm so excited to have you with us tonight. At the American Heart Association, we have long championed that every person deserves the equal opportunity to live a full and healthy life. This is why for decades we have worked to overcome major barriers like social determinants of health, rural health challenges, and more recently, structural racism as a major driver of health disparities. For example, Black people have higher mortality rates from cardiovascular disease and stroke compared with white people. The COVID-19 pandemic has only exacerbated existing health disparities, disproportionately affecting more Black, Hispanic, and Native American communities and people in rural areas. The path forward requires our commitment to transform communities. That includes improving the quality of housing, advocating for policies that promote access to economic opportunities, and ensuring access to quality education and healthcare. Our Empowered to Serve Business Accelerator is one of the many ways we deliver on this commitment. We are proud to partner with changemakers who inspire solutions across the nation. Tonight, we honor this impressive slate of community innovators and recognize our Empowered Accelerator alumni. They are relentless in creating solutions in communities across America to provide access to healthy food, housing, and healthcare. It's my honor to introduce someone who knows all about meeting people where they are to address hypertension and heart disease. Please welcome Mr. Andrew Suggs, founder of Live Chair Health and a finalist in our 2019 Empowered to Serve Business Accelerator. Andrew, welcome. We'd love you to say a few words.
Yeah, thanks for having me, Nancy. It's been a pleasure to partner with the American Heart Association over the last couple of years since my initial starting in the Empowered to Serve Business Accelerator. The American Heart Association has been a tremendous partner of Live Chair Health over the past 2 years, providing a lot of resources and support in our barbershop salons. And now we have expanded to other trusted community venues as well to further our goal to address health disparities, specifically around hypertension and ethnic minority communities. So I'm delighted to be here and to have been a finalist for the Business Accelerator. And I'm so excited to see the new breed of entrepreneurs doing wonderful things to change the landscape in our country.
Thank you, Andrew. We love your passion. We love your innovation. Thank you so much for being part of the Empowered Accelerator. You're exactly what the Accelerator is all about, lifting up communities and putting access and resources where people are. To those of you watching at home, if you would like to learn more, make sure to visit empoweredtoserve.org while you listen to tonight's amazing program. And speaking of the program tonight, it's with great pleasure that I introduce our MC for the evening, a dear friend and a volunteer of the American Heart Association. She is a powerful stroke survivor celebrating 5 years of recovery. Sharon Epperson, the senior personal financial correspondent on CNBC, is committed to improving financial literacy, particularly in underserved communities. And she was invited to the White House during President Obama's administration to speak about financial literacy. Sharon became a staunch advocate for health and wellness issues with a focus on raising awareness about brain aneurysms and funding for research after she sustained a ruptured brain aneurysm and nearly lost her life in September 2016. Sharon, every time I see you, your vibrant face, I am reminded of the power of survivors and the power of medical innovation. Thank you for being here to run this program tonight. I know we'll have a great time with you at the helm. I'll turn it over to you.
Thank you so much, Nancy. I am so excited to be here tonight and to join you once again for such an important event. You know, I've been following the candidate stories online, and I'm just excited to see who ends up with a grant tonight. But in my mind, they're all winners. You know, as Nancy mentioned, I am a brain aneurysm survivor. I survived a hemorrhagic stroke, and I know very well about health disparities from a personal perspective. I am the fourth member of my family from 4 generations to suffer a hemorrhagic stroke, and I am the only person who survived. You know, there have been numerous studies out there that show that Black and Latinos have a much higher incidence of hemorrhagic stroke than whites, but there's very little research on these communities that are disproportionately affected. And that is what the American Stroke Association, a division of the American Heart Association, is working to do. And that is why I am so passionate about working with both of these organizations to really impart change. So I'm delighted to be here, and I'm especially happy to be a part of the American Heart Association's Empowered to Serve Business Accelerated finale. You know, they've been through an intense training and grant opportunity that is designed to help solve health disparities. Through the Accelerator, the American Heart Association empowers entrepreneurs, startups, nonprofits, and candidates like the ones you're going to see tonight to build powerful partnerships that uplift community-centered solutions, that change behaviors, expand access to resources, and improve long-term health by overcoming systemic challenges. The candidates you're going to see tonight went through a rigorous 8-week curriculum that focused on strengthening their business models, and the core curriculum also instructed on design thinking, consumer discovery, market positioning, brand development, fundraising, all of this to create sustainable and scalable solutions. So let's take a closer look at what tonight's candidates have gained from the Empowered Accelerator training experience.
The Business Accelerator process was extremely valuable in that it encouraged us to look beyond the initial problem that we had identified, but also to look at things like the value proposition for the customer, the farmers that we were going to be working with. What was it about what we were offering that would really make this attractive to them? And so again, just learning to develop the business model was an extremely effective part of the Business Accelerator experience.
I'm so grateful for having had the opportunity to participate in the Empowered to Serve Business Accelerator. It has really pushed me to refine EMT Tomorrow's unique value proposition and to work on mapping out a more scalable and sustainable plan for growing our impact.
American Heart Association's Business Accelerator has been an amazing experience for me and my nonprofit. These last several weeks, I've been able to build out my brand's mission and understand the importance of telling our brand story. And I've also been able to build relationships with other nonprofits and other business owners around the country. And thanks to this program, I'm going to continue to make an impact in my community.
This accelerator has been an incredible gift, truly. I have had the chance to go back and really dig deep into our roots and the why, the essence of what the heck we're doing and why it matters so much. And to have the chance and the coaching and the governance and guidance to examine that, interrogate it, and shape it just right is an everlasting gift.
How would I describe the experience of being in the Empowered to Serve Accelerator sponsored by the American Heart Association? I would say to any founder of a mission-driven startup, if you get this experience, grab it with both hands and run with it. It's both intense but intensely rewarding, and for any mission-driven startup, like self-care, for your startup, because of the focus on authenticity and mission. Thank you.
The American Heart Association Empowered to Serve Business Accelerator was an amazing experience for me. It challenged me to new levels of innovation that I simply hadn't considered. It also allowed me to identify issues while offering attainable solutions.
Being a part of the AHA's Empowered to Serve program has been incredibly rewarding. As an early stage founder, you're always looking for resources. You're always looking for folks who can help you tell that story better and make it more compelling. And Krista has been the foundation of rewriting that story from what I did have before and just really helping me hone in on my why.
Oh, the American Heart Association Business Accelerator has been an amazing experience. We as social entrepreneurs know what drive us. We know what our passions are. But this program helped to provide a lot of structure in helping us understand the business aspects of our work. And so the week-by-week engagement that Krista afforded us as part of this experience was amazing. It's a combination of YouTube videos and reflective exercises that helped us delve deeper to really understand how to communicate our work as entrepreneurs and also the work that we do every day. So in one word, amazing. I look forward to continuing to reflect on the different things that we had to really reflect on as entrepreneurs. So thank you, Krista. Thank you, American Heart Association, for the opportunity to swim deeper. You threw us in the deep end, but you kept us in the shallow water too. And that combination was amazing. So thank you for challenging us to be great.
And I would say thank you all for inspiring us with your stories about what this accelerator program has meant to you. You know, now we go to the tough task of introducing these amazing judges that we have, because I say tough task because that's what they have in trying to pick this year's winners of this program. We have 4 extraordinary change makers who are going to have the tough task of selecting the grantees tonight. Alfred A. Edmond Jr. is Senior Vice President and Executive Editor at Large of Black Enterprise. He's also a trusted mentor, advisor, confidant, and a good friend too, to me and dozens of accomplished entrepreneurs, professionals, and leaders. He pursues and promotes health and fitness as foundational to business, financial, and life success. You just have to follow him on social media to know that. Alfred, it's great to have you as a judge tonight.
It's great to be here. It's great to see you, Sharon. And it's great to be a judge for this pitch competition. The Empowered to Serve Business Accelerator has inspired me. As you know, Sharon, I am a geek about entrepreneurs, where other people follow their favorite athlete or their favorite entertainer. And it's where I get a lot of my mentees that I've been mentoring over the years as a business plan and pitch competition judge over the last couple of decades. And I was not disappointed with the caliber of entrepreneurs that we were allowed to hear their stories, learn their missions, and like you said, the tough task of saying, well, who is really the one that's going to get some grant recognition? But they are all winners. I know everybody likes to hear people say that, but some of the most successful entrepreneurs I've met are people who did not win the pitch competition, but they won in every other way in terms of the relationships and the resources that allowed them to succeed even beyond their experiences here. So I'm looking for great things from all the entrants. And I'm going to be following them as a journalist at Black Enterprise, following their exploits even beyond today.
Absolutely. It's a valuable experience no matter how it ends up tonight. It's an experience that will be with them for their lives. You know, Dr. Monique Jimenez is a cardiovascular epidemiologist whose work is focused on understanding the intersection of sex, race, ethnicity, and socioeconomic factors in stroke and cardiovascular disease inequities. Over the years, she's taught several courses at Harvard Medical School and the Brigham and Women's Hospital. And Dr. Jimenez, I'm really excited to meet you for many reasons. As you heard earlier, I'm very interested in your work and I'm reading it.
Thank you so much, Sharon, for that introduction. And thank you for your bravery and sharing your story with all of us. That holds so much power. And I want to thank the AHA and the other esteemed judges here tonight, and also our phenomenal finalists. And I was really excited to participate in this tonight because I firmly believe that the most innovative and disruptive solutions to addressing health inequities are going to come from our community leaders with their boots on the ground, that are closest to our community needs. And I am really excited about all of these proposals. And thank you, everyone, for sharing them with us.
Thank you for being here. Our next judge is someone that I had the pleasure of meeting a year ago, and it is amazing what 1 year can do. Prathamesh Desai is the 2020 Empowered to Serve Business Accelerator runner-up and the fan favorite grant recipient. He co-founded Safe BVM to increase access to safe and personalized manual ventilation. Prathamesh's dual background in engineering and medicine fuels his efforts to use technology to address healthcare challenges related to training, cost, access, and low doctor-patient ratio. I so enjoyed your presentation last year. I understood completely why you were the fan favorite, and I'm delighted to have you as a judge with us tonight.
Thank you so much, Sharon. I cannot believe it's been only 1 year since I was on the other side as a participant. Thank you once again, American Heart, for the opportunity to participate in the cohort. The Business Accelerator has helped my startup Safe BVM a lot. We learned new skills, created educational videos utilizing the grant award. And all of this has brought us one step closer to our mission of improving the standard of care for emergency manual ventilation and cardiopulmonary resuscitation. And not just with the American Heart Association grant. Following the grant, we were awarded 3 more non-dilutive grants of a total of $170,000 by National Science Foundation, National Institute of Health, and US Air Force. So folks, the journey to improving health equity and solving problems for under-resourced communities is incredibly challenging and requires a lot of patience. So to all the 8 extraordinary innovators, I would like to offer my best wishes.
Thank you so much. Thank you very much. You know, I also want to say welcome back to Shelley Omalady Bell. She is a system disruptor and business strategist who's been a judge in this accelerator program in the past. She moves ideas to profit while empowering people to live more authentically. And as a cultural translator, she connects entrepreneurs, investors, and corporations to diversify their talent pipeline, increase equity, and grow their brands. Welcome back, Shelley. Great to be here with you.
Yes, thank you so much. Great to see you again. Thank you to the American Heart Association for having me again. I'm always excited to engage in this because similar to what Alfred mentioned, athletes, that's how we look at it at Black Girl Ventures. We look at business owners, small business owners, and entrepreneurs being elite business athletes. And that opportunities like the American Heart Association's training, accelerated training, offers them the training for them to get in the game and win. So I'm always excited to see the new ideas. I'm in a full belief that the ideas for the future will come from programs like this.
Absolutely true. Well, we appreciate each and every one of you volunteering your time to support the accelerator, to be judges tonight. So thank you all. And we're now at the best part of the show, or the show that I'm so excited about. Tonight, we have 8 extraordinary innovators who are going to share their business stories for a chance to receive a grant. And did you know that October is National Women's Small Business Month? Well, coincidentally, this year's candidates are all women. And this is a first for the National Accelerator. And I'm so excited to share these phenomenal women with you and to have them share their work with all of you as well. Now, don't forget to vote for your fan favorite. They are, as they share their business stories, the voting is going to be open until the end of the story pitches. And after the pitches are completed, we're going to hear from a special guest as the judges cast their votes. Now, we're going to conclude the evening with announcing the $50,000, $10,000, and fan favorite grants. Our first innovator of the evening is Cornelia Williams with EMT Tomorrow, I should say. Cornelia, welcome.
Hello, I am the co-founder and CEO of EMT Tomorrow, which is a 501c3 nonprofit based in Washington, D.C. At EMT Tomorrow, we are working to eliminate disparities in emergency healthcare by providing free, accessible EMT training and job placement in underserved communities. So I want to start off by telling a true story. In 2019, Elijah McLean, a person of color, died in Aurora, Colorado after 2 white medics failed to follow medical protocols before and after injecting him with a high dosage of a powerful sedative called ketamine. While Mr. McCain was already handcuffed when the medics arrived, the medics still did not talk to Mr. McCain, they did not check his vital signs, and they did not properly monitor him before and after giving him the drug. Mr. McCain went into cardiac arrest on the way to the hospital. While I'm sure many of you have heard Mr. McCain's story, it's unfortunately not isolated. The EMS field does not provide the same quality care to all. For example, minority patients are 20% less likely than Caucasian patients to receive pain assessment and pain medications for the same amount of pain, among other disparities in care. And as an EMT myself, I know that these problems exist. So when developing EMT Tomorrow, we at my team look to discover what is needed to change the system to make it more equitable and to improve health outcomes. What my team found is that the cause of this problem is twofold. First, there's a lack of representation of minority communities in the EMT workforce. There's also a lack of quality, culturally competent EMT training. So with respect to representation, nationally, about only 7% of EMTs identify as Black and 8% identify as Hispanic, which is not representative of the diversity in the US population. Unlike other first responder training, like police officers or firefighters, traditional EMT training does not come free. It can cost anywhere between $2,000 and $5,000, which is not affordable. This in turn means that low-income communities, which are also often communities of color, receive emergency care from EMTs who live outside of their community and may not understand their needs. On top of that, traditional EMT training, due to just the generality of its curriculum, is not designed to teach the skill sets needed to provide culturally competent and compassionate care for every patient. With these considerations in mind, my team developed EMT Tomorrow to drastically change the way that emergency care is delivered in minority communities. EMT Tomorrow offers a completely free, accessible National Registry EMT training and job placement for under-resourced young adults to support a career in emergency medicine. That way, EMT Tomorrow trained EMTs can serve and uplift in their own communities. Our program is also distinct in that we offer the EMT Tomorrow certification, which uniquely encompasses the holistic skills that an EMT should have in addition to medical skills. For example, EMT Tomorrow trained EMTs can de-escalate a behavioral or mental health situation. They can connect their patients to local community-based resources, and they can understand how underlying biases can impact care or impact their own perspectives. The EMT Tomorrow program is also a bridge to economic mobility for these young adults. EMT training is unique from other medical professions in that it only requires a high school diploma to be academically eligible. So once you become an EMT, there are a host of career pathways that EMTs can take, such as becoming a paramedic, becoming a physician's assistant, or a firefighter. So through the EMT Tomorrow program, we can help break a cycle of poverty through self-empowerment and financial stability in young adults who do not often have opportunities for workforce development. We already have a talented staff, including our medical director, who has been in the field for over 30 years, and our course instructor, who is qualified to teach a national EMT curriculum. We also receive strategic direction from our board of directors, who includes the assistant fire chief of EMS operations for DC Fire and EMS, and also the manager of one of the Northeast's largest workforce programs in healthcare. We've partnered with America's largest EMS employer, who can offer every student in the program a paid position after completing the course. Additionally, the district's Department of Parks and Recreation is supplying us with a recurring pipeline of students and facilities to operate our courses out of. Funding from the American Heart Association will set us on our path to train over 1,000 students in 4 urban centers over the next 5 years, impacting the care of tens of thousands of patients. So I ask that you join in our mission to create an accessible EMS education pathway for under-resourced young adults. Thank you.
Thank you so much, Cornelia. I am so grateful for the paramedics, the EMT folks that I have met through my journey. And I am so thankful for the work you're doing and the work that you continue to do with EMT Tomorrow. Next up is Maya Page, who leads Carrie. Maya, tell us about your story.
Thanks. Carrie is a movement and meditation app for pregnant people and new parents, and our story is both professional and personal. There I was, 9 months pregnant with my 3rd baby, just wrecked by whole body anxiety. lying awake at night, and I needed sleep. I needed relief before she came. I wasn't alone. Half of all pregnant people experience anxiety. That number is now 80% amidst these pandemic times. Add in the terrible effects of systemic racism, increasing maternal mortality for Black and Native women, as well as the fact that 45% of all pregnancies in the US are unintended. And well, that makes for a whole load of different mindsets for the 4 million Americans on this journey each year. What helped me? Well, moving my body during the day and at night listening to audio meditations. And okay, this one song on repeat over and over. But by moving my body, I was one of the few, only 10 to 20% exercise during pregnancy, despite evidence that it improves maternal and baby health outcomes. Pregnant people everywhere need access to this powerful, proven set of tools of movement and meditation. The good news is that anyone can move their body in simple yoga shapes, and anyone can breathe with intention if we show them how. And with Carrie, we're going to do just that. Let's look. Movement and meditation sessions organized by all trimesters, including the 4th postpartum. My body ache, like upper back and shoulders, or low back love, or hip openers, or need mentally, like making space or taking a pause. Knowledge articles too, and we keep them short because we know you don't have time. Throughout, we hear various accents and see different bellies, bodies, and babies matching multiple families and mindsets. We're straightforward, real, and optimistic. This is Planet Parent and not an airbrushed projection. We know. My co-founder, Heather, is an incredible teacher of doulas, a pre and postnatal teacher, a childbirth educator, physical therapist, lactation counselor. I could go on, a parent herself. And when I was in her classes, I learned calm, confidence, and strength, and I knew the world needed more access to this powerful mind and body training. Her expertise paired perfectly with mine in experience design, mobile apps, innovation, and UX, honed at Stanford, Adidas, IDEO, and Target. I asked my 2 favorite software engineers from the Adidas innovation team to join, and we started researching, prototyping, bootstrapping, and thus Carrie was born. We're live, quietly on App Store, and with 0 marketing and 0 promotion, I'm proud to say we have paying users. This traction is not a fluke. People are looking for this kind of thing. We offer a free trial and then a monthly subscription at $11.99 after that. And we're in good company with meditation apps projected to reach a $2 billion market pretty soon. And of course, the proliferation of virtual wellness. The time is now. And fresh off of a recent grant win from the AHA, as well as feedback like Meg's, writing me on the way to the hospital for an induction, that our early labor meditation helped calm some of the anticipatory anxiety she's feeling. Man, I know we're on the right track. Today, we're laser focused on all 4 trimesters of pregnancy. Tomorrow, we're going to carry them right through, having earned their trust from the beginning, to early parenting with those same mighty tools: breath, movement, and knowledge. The physical and mental needs persist even when your babies become toddlers, become kids, become big kids, teenagers. I know, I need an app like this right now. I've got 3 kids under the age of 7. I work on this startup, and I help care for my own disabled parents, and the epitome of the sandwich generation. I need all the help I can get. We also know from research that healthy parents drive healthy behaviors in their children. And what could be more important than that? We can do this. We need to. Further research shows that these tools alleviate pain, depression, stress, anxiety, and even improve birth outcomes. With our beautifully designed, diverse, real, curated, safe app, Carrie offers mighty simple tools to carry you through pregnancy, birth, and beyond. We are here to steady your parenting journey, and our vision is less fear and more confidence for every pregnancy and parency in the world. We're here to raise the well-being of all parents.
What a wonderful concept, Maya. Namaste. Thank you so much. We appreciate you sharing that with us. And we're going to go now to Victoria Beatty. She's going to share with us about Growing Places India. Indy. Victoria, the floor is now yours.
Thank you. At Growing Places Indy, our mission is to cultivate wellness through urban farming. One of our goals is to focus on food access, eradicating food deserts, and helping to decrease childhood obesity through providing urban farming programs for high school students focused on STEM. When I was in high school, I was extremely overweight. I lived in one of the largest food deserts here in Indianapolis, Indiana. The closest place to shop was the 7-Eleven, which often had overripe, expired, and overprocessed food. The closest grocery store was over a mile away, so my mom often bought fast food because she worked 2 jobs and was not only the most convenient, it was the cheapest option. So by the time I graduated high school, I was extremely overweight and unhealthy. But my story is not unique. There are thousands of young people currently living in a food desert. Currently, 200,000 people are currently living in the food desert here in Indianapolis, Indiana. Food deserts have contributed to heart disease and other chronic diseases for years. In 2018, I moved back home to Indianapolis after working for a large fast food brand. One, I really wanted to learn how to grow my own food, and one, I really wanted to relearn my relationship to food. So I learned how to grow my own food through Growing Places Indy, and that is where I found my true passion of teaching my community the importance of knowing where your food comes from. A year later, I became the executive director and launched the Young Grow Getters program. The Young Grow Getters program is a high school program for students ages 15 to 18 years of age. We focus on students who are deeply impacted by food insecurity. The program is broken up into a paid 7-week program where the students are immersed into how the food system works and works with everyone from engineers, urban farmers, and entrepreneurs so they can get a 360 view of how the food system works here in Indianapolis. Not only do we want to create the next generation of urban farmers, we want to create the next generation of healthy eaters. We successfully launched our program this past summer and currently have a waiting list of students who want to participate next year. Currently, our program is partially funded by the USDA, the United States of Agriculture, PNC Bank, and also individuals who want to help see our program succeed. With the help of a grant from the American Heart Association, we'll be able to double our impact by doubling the amount of students that will be able to be in our program next year. I believe as a young person, if I was given this program and had the opportunity to understand how the food system works and how it impacts my body, I would have made healthier choices as a young adult. Lastly, I can be remiss without highlighting the ancestors and our indigenous people who built the industry that we know now as agriculture. And lastly, food insecurity and childhood obesity is not an individual issue, it's a community issue. Thank you.
Thank you so much, Victoria. You are going places with Growing Places Indy, and we thank you for sharing with us tonight. Now to keep it going, we're going to go to Cynthia Wallace with Urban Farming Academy. Cynthia.
My name is Cynthia Wallace, and I'm the executive pastor of Bible Center Church. Bible Center is located in the community of Homewood, which is in the city of Pittsburgh in the state of Pennsylvania. Homewood is not unlike many communities in our country. It was once a very vibrant community with lots of businesses and lots of people, but unfortunately, gang violence and job loss and other things over the last 20 to 30 years have really left this community decimated. One of the challenges in this community is that we're considered a food desert. There's not a grocery store in the community, and people just don't have access to fresh produce. This is one of the challenges because we know that it makes a difference. The things that people eat and the food that they have access to really has an impact on even how long they live. Bible Center Church has been in Homewood since 1956, and we have focused on issues centered on education, employment, entrepreneurship, and the environment, which for us is the adaptive reuse of vacant and abandoned properties. And we're helping the community to really come back. One of the things that we've done over the past couple of years is we have worked with individuals who have business ideas to grow and scale their businesses. And so we've worked with over 50 entrepreneurs to help them really learn how to start businesses that can be thriving. So through the project with the American Heart Association, we are excited that we're able to combine helping those individuals who have food access concerns with business. And we're doing that through our Urban Farm Academy. In the community of Homewood, there are actually 5 urban farms who work together to provide fresh produce to people in the communities. And they've done this for a couple of years. Through this project, the Urban Farm Academy, we are hoping to help those individuals, as well as many other urban farmers, learn how to expand their business models. We intend to provide classes which will allow them to understand how to extend their growing season, how to address maybe pests organically, how to help them understand marketing for the farm work that they're doing. And so we hope to be able to help them not only be able to meet the needs of the community as it relates to food access, but also to be able to have a thriving business while they're doing it. Bible Center's food system is unique in that we have a cafe, a farm, and a commercial kitchen. And so we've been able to demonstrate the synergy that can exist when you have that powerful system. And so we're hoping to be able to teach urban farmers very similar principles. Urban farmers in our communities have not sat on their hands and just wondered, how will we get food to our community? But they have really literally rolled up their sleeves and got their hands dirty by providing produce to the community for farming. So again, we're looking to be able to expand this program, helping those urban farmers to develop those business models so that they can increase the amount of produce that they can get to the community, but also so they can have a thriving business themselves. Thank you.
Cynthia, thank you. And thank you for coming from my hometown of Pittsburgh. Hearing you talk about Homewood, where I had my first job as a bagger in a grocery store that's no longer there, and going back home in the summers and around the holidays and seeing the food desert that you're talking about, the need is so very great in so many communities, but particularly in my hometown, in the community of Homewood. So I thank you for sharing that with us. As we move on, I want to make sure that now that we're at our halfway point, there are 4 incredible pitches left to go here. But before we get to that, I don't want you to forget that the fan favorite voting is going to close soon. So I want to make sure you get your votes in, make sure that you vote for your fan favorite. And now we're going to get back to the show. Next up, please welcome Sharon, another Sharon Samjitsine, and the Healthcare Originals Company. Sharon.
Hello, as the intro said, I'm Sharon, co-founder of Healthcare Originals, provider of Nightingale Digital Health. We help people with asthma and chronic obstructive pulmonary disease, or COPD, live enriched, full lives and provide peace of mind for their caregivers. People with asthma and COPD have difficulty swallowing because of swollen airways and mucus buildup. I've had asthma all my life. Living with this is not easy, not just for me, but for my family. That's why we do this, to alleviate that burden. We can't be cured. Instead, every day we must log medications, symptoms, triggers, and environments. It's all very complex, and it seems counterintuitive, but over time, people like me become less able to recognize worsening symptoms early. In the US, there are 10 asthma deaths and 2,300 emergency department or ED visits every day. We impact this. Nightingale is a platform for people with asthma, COPD, and their caregivers. We spend at most about 1% of our lives with physicians. Nightingale is there for the other 99%. Our respiratory therapists and life coaches ensure our members are engaged and activated around a life goal. Our proprietary wearable, Adam, tracks and learns each member's unique symptoms and baselines and shows them when they are trending away from that into an undesirable event. This gives everyone enough time to take the necessary steps to avoid an ED visit. Nightingale empowers us to have meaningful conversations with our providers. Now, when I was 5 years old, and many times after, I almost died from asthma attacks. These attacks affected not only me, but my parents, my sister, and now my husband. My husband and I moved from the warm Caribbean to Rochester, New York, which gets about 100 inches of snow per year. A fact, cold air is an asthma trigger. In fact, about 70% of Winter Olympians have asthma. So yeah, I moved to Rochester for the weather. We're in the Finger Lakes region of New York State. And here, social determinants of health, or the impacts of them, SDOH, and health disparities are glaringly apparent. If we compare data from 8 high poverty zip codes, but the rest of the city of Rochester, we see that in these areas, ED visits are twice for asthmatics than the rest of the city. African Americans and Latinos are the majority of the populations in these areas. These trends are also seen nationwide. CDC data shows that asthma is most prevalent among African Americans and Latino populations, and they make up the bulk of the ED visits. So let's see why that might be. In 2018, the University of California, at San Francisco, published the results of the largest ever study of drug responses for children with asthma. The results showed that African Americans and Puerto Ricans showed the least beneficial response to albuterol. This is deeply alarming because albuterol is the drug that's most widely available for symptom relief. This shows that there is a real need to better understand individual symptom and medication response. Enter Nightingale. When I was 11, my doctor listened when I told him that albuterol didn't work for me. We switched through medications until we found a combo that worked for me. Just imagine how different our outcomes would be if everyone were empowered to be their own health advocate. Nightingale accomplishes this. With Nightingale, members understand their condition and symptoms better. Doctors have better objective data to improve treatment efficacy, and caregivers have peace of mind. Results show that Nightingale is efficacious in improving quality of life measured by clinically validated tools. How? Because our members are engaged and we meet them at the point of their need. We provide an optimal, personalized mix of text tips, apps, devices, and human touchpoints. Wi-Fi and HEPA filters round out our offerings, accommodating for SDOH. Our most significant differentiation, our elegant wearable Atom, the world's first ambulatory cough monitor. It's discreet, soft, comfortable, and tracks all the relevant symptoms of asthma and COPD, including lung and cough sounds. Nightingale improves outcomes. In the US, there are 25 million people with asthma and 16 million people with COPD. So we have lots of impact that we need to make. The leading asthma center in Rochester, Mary Parks, committed to supporting us. With the $50,000 grant from the AHA, we will work together with community leaders to identify and enroll 109 high-need patients with asthma and COPD. They will be in Nightingale for 1 year. Within 6 months, they will experience improved quality of life and reduced ED visits. The grant will have at least a 5 times monetary impact on our community. We will then scale nationally. Nightingale will impact the lives of many in need. We're excited to demonstrate our impact. Help us make it happen. Thank you.
I'm excited to see the impact. I'm sure, like many of you, every person that is presenting tonight has developed something that is touching our lives, that is touching a family member's life. And in this case, my in-laws who live in Rochester. So it is so important that we listen and we support each one of these businesses. As we said at the beginning, regardless of who becomes a grantee tonight, everyone is developing something that is so needed in our communities. And so I thank you all for sharing with us. And I thank everyone who's listening for paying close attention to these businesses, because they're ones that you're going to want to use in the future. The next voice that we're going to hear from is Kimberly. Kimberly Brown is with Get Up and Get Moving. What do you have for us, Kimberly?
Thank you so much. And thank you, American Heart Association, for this business accelerator. I'm so excited 'cause it's time to make a change. Gonna make a new start. I'm gonna do things different this time for the sake of my heart. Gonna leave the past behind. Don't wanna live with no regret. I'm thankful for another chance. Might be the only one I get. So get up and get moving to a brand new day. You've got the power inside. If you want to find a new way, get up, get moving to a brand new start. Bring a friend and join the family. Do it for the sake of your heart. Oh, yeah. And just like our theme song says, I'm inviting communities of faith everywhere to get up and get moving. I'm Kimberly Brown, and I love to sing. I've spent 15 years of my life with the 3-time Grammy Award-winning group, The Sounds of Blackness, under the direction of Gary Hines, produced by Mr. Jimmy Jam Harris and Mr. Terry Lewis. And I've had the pleasure to sing with great legends such as Stevie Wonder, Quincy Jones, the late Luther Vandross, Prince, and others. But I'm also the founder and creator of Get Up and Get Moving. It's an online motivational fitness program that helps people living sedentary lives get up and move. We have a problem, and sedentary lifestyle is a large part of that problem, along with the absence of and access to the right information. As a pastor's daughter, I've seen many in ministry, including my own father, who, by the way, does encourage me often, but I've watched them as they neglect their own health while caring for their congregation, their members, and even their families. And later in life, they deal with health issues that could have been prevented, reduced, or even avoided if only they had known. But Get Up, Get Moving offers a solution. So I'm starting with communities of faith, independent care facilities, and even an online platform. For many, physical fitness has fallen to the bottom of the priority list because of lack of access, busy schedules, or not having clear and relatable instructions for better health. I'm sure you know someone who, with proper physical activity, better nutrition, and health choices, could have lived a longer life. I'm sure you know someone even right now that really wants to make that change, but they just don't know how and they don't know where to start. And maybe, just maybe, that someone is you. So we're developing an app, and it includes a series of 30-day challenges. And with these challenges, we're going to help users begin their way to better health and work their way up to 30 minutes of physical activity every single day. Our app, it's going to also include how-to videos, health tips, ways to track your numbers, like your weight, your blood pressure, your daily steps, a motivational list, a music playlist, a pastor's corner, a way for community members and users to inspire each other, social media platforms, and ways for them to become proactive in managing their own health. We have a commitment to lead communities of faith everywhere to better levels of health. We're going to do that because this online program is so vital. Just in the United States alone, there are over 350,000 churches representing 200 million members. And worldwide, well, there's over 37 million churches worldwide, representing hundreds of millions of members. These members are vital in building healthy communities. And while we're building this app, we have interest from pastors in several states in the US and also in other countries like Kenya, Liberia, and the United Kingdom. We have the power to save lives by reducing death and diagnoses. This grant will help us to do just that by allowing us to shape the app to meet the needs of movers everywhere. And did I happen to mention that it costs absolutely nothing to download this app? It's free to users everywhere. This grant, well, it's also going to allow us to provide additional levels of content for those who want more. Those additional levels, along with our advertisers, are going to generate streams of income. Our goal is to ensure that Get Up, Get Moving encourages pastors, congregations, families, individuals, and people everywhere to live optimal lives with optimal health. So with every effort possible, we will continue to encourage, inspire, and motivate people to get up and get moving. Do it for the sake of your heart.
Yeah, let's do it. Well, that is quite a mission and quite a voice that you have, Kimberly. Thank you so much. We're going to keep it moving with 2 more amazing stories to share. And don't forget to keep your votes coming. We now have Shireen, Abdullah, and Yemlish. Shireen.
We're Yemlish, and our moonshot is to eradicate diet-related chronic illnesses and address socioeconomic barriers to dietary adherence. I want to introduce you to someone. Her name is Carla. She's a mother of two of Mexican origin. She gets a type 2 diabetes diagnosis, and the best advice her physician can provide to her is eat healthy. There's a gap in diabetes management today in that it takes a one-size-fits-all approach, largely focused on connected devices, but does not address nutrition in a meaningful way for Carla. In fact, Carla's life hangs in the balance in our ability to deliver great care. Nutrition is fundamental to that care, and she is not receiving that today. Carla is not alone. There are 6.4 million Hispanics with diabetes that are underserved largely with what exists. So that's where we come in. At Yemlish, we've taken the standard of care for diabetes prevention and diabetes management and culturally adapted it in order to make it more relevant for someone like Carla. We have further paired this core value proposition with registered dietitian support, peer support, and device-less remote patient monitoring. Ultimately, we've created a low-cost solution with low barriers to adoption, provided entirely over text and web. We know that it works through the impact that we have seen on outcomes, weekly engagement, building 12.5 touch points, virtual touch points per patient per week, and a 90% attendance rate in our program. This is an expensive disease state, and using reimbursable encounters alone, this is a $1 billion market. We have relationships with 2 health systems. We are also working with school districts here in the Texas area. And in fact, if we just focus on the school district model, that is a $20 million revenue potential for us. There are opportunities to scale using additional technologies and solutions. And why are we the right team? I have an MBA of PMP, been a management consultant for a number of years, and I know how to run these projects. We have faculty members over from Northwestern University leading our AI and technology efforts. We have subject matter expert registered dietitians on staff, and we have digital health experience. We have also received awards from the American Diabetes Association, from the NIH, and the CDC. We need strategic partners, and this grant from the American Heart Association will really help us build infrastructure and team. At Yemlish, we're on a mission to eradicate diet-related chronic illnesses and bridge gaps to create health equity so that Carla gets the care that she deserves. Join us.
That's wonderful, Shireen. Thank you so much. Great job. Now, closing us out tonight, last, certainly not least, though, is Bobby Banks with Pillar Consulting.
Thank you. As a social entrepreneur trained in epidemiology, my passion for the past 15 years has been to investigate patterns and causes of disease. From the HIV/AIDS pandemic, where my public health journey began, to the current COVID-19 pandemic, my focus has been to promote health, whether it's through community education, research, or advocacy. And I know that data is key to showing us problems that exist in communities, but what's equally important is knowing what's needed to solve these problems in communities. And so what we know at Pillar Consulting and pursuing equity and justice in health and engaging with leaders with the American School Health Association, or even partnering in the spirit of advocacy with Susan G. Komen Foundation or Nurture New Jersey, is that the who and the how when it comes to education is equally as important as the science and data. And we already know the consequences when it comes to misinformation around science and data could quite frankly be death. And so we want to share with you some of what we feel is very important when it comes to the who and the how with education advocacy. And our belief is that it's innovation and culture. So I want to share with you our digital campaign called Not a Host, or NA. Our goal is very simple with this campaign. We want to build a brand community in which we offer our expertise, knowledge, tools, and training, and additional resources so that people understand the fundamental information when it comes to COVID-19 risk. One simple term for people to remember, and that's host. Most people understand in the social sense. At the height of the pandemic, we cannot have 50 people in your house. More people equal more opportunity for the virus to spread. So we're asking you, whether you call yourself a host or not, to not be a host. The other part that we knew as scientists that was more problematic is that people didn't quite understand viruses and how they work. They've been here long before we have, and they'll be here long after we leave, but they do two things. They multiply and they mutate, and they need a host, a ticking heart, a warm body so that they can do that. And so when the scientists tell you to cover your nose and cover your mouth, not a host, nah. That's the culture and the innovation that we brought to the COVID-19 space. And so last November, we launched this campaign online in the digital space, and in the first week garnered over 100,000 views. What was more mind-blowing was that this week included, the first week included, what was more mind-blowing was that our first week of promotion included 3 major holidays: Thanksgiving, Black Friday, and Cyber Monday. So we knew not only did we have a message with not a host or nah, we also had an audience who wanted to know how to lower their risk at one of the most high-risk times. You think about colder weather, more engagement with families. So we had a message and people wanted to know more. Since then, we have received support to continue educating communities about safe interactions with their families. And so we have received support from the Facebook Small Business Grant, Blue Cross Blue Shield of North Carolina, Duke Health, United Way, and many others as we continue to educate individuals about COVID-19 risk. What we know as a result of our education is that people understand trends, they understand their risk as it relates to them and their loved ones, and they better understand how to communicate with their providers about COVID-19. That's where we've been. I would love to share with you where we're going with support from the American Heart Association Business Accelerator. People have heard over the last 19 months, you can't do this quite yet, it's still not safe. And so that, days turn into weeks and weeks turn into months, and now we're here 2 years later. We want to provide an opportunity for people to show what they can do. And so everything I've shared with you at present, including our reach of over 100,000 people, is education. It's kind of one way. We are firm believers, not only that we are the people we've been waiting for, but let the community lead. And so we're looking for your support to drive engagement. We want to scale the Not a Host campaign with our organizational partner, the Council on Black Health, not only in the Durham area, but also Atlanta, Chicago, and Charlotte. And most importantly, we know there are young, brilliant, untapped minds who want to create and who want to serve. We are going to launch a youth ambassador program with the Not a Host foundational principles when it comes to prevention. And we're going to let these young people show us how to keep it right. Whether it is they're keeping it virtual, whether it is they're keeping it simple. They're going to their aunt's house for Thanksgiving, but they're using plastic utensils. So everybody's not putting their hands on the same things and we're not swapping saliva. And so we are looking for your support to expand this program, to launch a youth ambassador program. And what we also know is that COVID-19 is continuing to manifest itself in rural areas. And so we're looking to supplement this digital campaign with print materials. What we know is that the Spanish flu killed over 675,000 people. HIV/AIDS over the past 30 years has killed over 700,000 people. COVID-19 in a fraction of the time has killed over 700,000 Americans. And scientists all over the world know that the next pandemic is not an if, it's a when. And so we are looking for your investment so that we can invest in the young, brilliant minds to lead us and lead the way. So when the next pandemic comes, that we are poised and positioned, not only with data and science, but culture and innovation, starting with keeping it right. Thank you so much. My name is Dr. Bobby Banks, and I'm the founder of Pillar Consulting.
Dr. Banks, thank you so much. There have been so many fascinating stories tonight about amazing businesses. and you're seeing me here on, like you are probably, on the laptop, looking them up as they're talking, checking my phone to see. And also, I can't do this, but you should be doing this, checking my phone to see who I can vote for a fan favorite. Don't forget to do that, because we're going to close the voting for that very, very shortly. I don't know how I would decide between all of these fantastic finalists, and the judges have such a hard task ahead of them, but they're going to do it. They're going to do it. And keep in mind, my mantra is all of them are winners, and all of them are businesses and enterprises that we're going to continue to follow for years to come. We're going to let our judges get some time here to deliberate, to figure out what they are going to do. I don't know how they're doing it, but they're deliberating right now. And we want to hear some words now from Damon John, the people shark, who knows all about entrepreneurship and fundraising. Today, we have a very special guest joining us to share some mentoring tips and wisdom with you all, and to also share a bit of his own personal story, how you dealt with rejection and failure at the beginning of trying to grow your business.
So I created something for a culture. Some of the biggest challenges of what closes businesses and startups early is overfunding.
How to stay focused regardless of what is happening around you in your community, in your state, in the world, and stay focused on your mission, your purpose, and your business plan.
You need to be very, very clear in your in your agenda to help a very specific group or party of people or individuals or animals or the ocean, whatever the case is, and it needs to be tied directly to the purchase.
How did you overcome kind of your cancer scare several years ago to still stay focused on the task at hand and on your business?
I'm cancer free now, but there's something I have to stay on top of as an entrepreneur, and often you can't tell anybody your problems. Everybody thinks you walk on water. You're supposed to listen to everybody else's problem. I mean, all these entrepreneurs we're talking to here, you can't have somebody come into the office and look at the boss crying. They're gonna be like, well, I better leave because this thing is over. And I keep educating myself on how to my nutrition and exercise and other things. And I'm not perfect. We all know what we need to do.
People talk about social entrepreneurship. They say that they're social entrepreneurs. And sometimes I wonder if they really are looking at the greater good in what they're doing. But how do you define social entrepreneurship?
My company could have been defined as social entrepreneurship because we were empowering a certain community and we were bringing awareness to it, but it wasn't as direct, I feel.
Focusing on where people live, where they're born, where they live, what the communities are going through, and why is that type of social entrepreneurship so very important, particularly for communities of color?
We didn't have the opportunity of having legacy wealth and legacy information often passed down to us from people who had maybe better access to better healthcare, better access to schools and information. So this is why I believe that this gap is growing larger and larger and larger, and the whole country, our whole system is paying for it. We are not educating the people who need to be educated in this. And this is not a color issue. I think that anything that's ever been solved in this country around the world took people of all colors and all, a rainbow of people to get together and fight what we feel is injustice or something that needs the light to be brought to it. Because at the end of the day, these high tides, all boats are rising. We will all benefit from this.
There is a return on investment for investing in the professional development of those who are working around you and for you. Is that true?
Listen, if you got free competitions, you got places where you can win grants and they take no money of yours, absolutely do as many of those as possible, because you are in the room with the other A personalities and you are seeing how you better sharpen your blade. And even if you fail, you may have met somebody else. But if you are giving away any equity of company, you should wait until the last second when you cannot keep up with the orders or the business.
How do you incorporate those kind of those failings in your story about the success that you see for your business?
A real business is not even going to understand what it is within 3 years. That's why the IRS allows you to say it's a hobby for the first 3 years. Make those mistakes on your own quick and fast and get over them and then learn what you really want.
How many resources could be out there like this Business Accelerator program that you can get on your own? Even though you're the people shark, it's fascinating that you're telling people don't come to a funder first. Try to get it on your own. But I don't think people know where they can go.
The resources are out there. This is no longer, Sharon, like when you and I, we had to go to a library and dust off a book that was written 100 years ago. The information there. Stop looking at silly videos of people dancing and go through the resources and find what you need.
Do you have any other parting comments, Damon, that you want to share with everyone?
People are very, very sensitive now. They want to know, where do you stand on some issues, and they will back you if you are true. Now, I got to tell you, be careful. Do not go ahead and not believe in some issues or matters, because the same way that people will value, the same way that they will turn on you because they feel you're trying to exploit something that they are very, very emotional about.
The information you heard today from Damon, share the link to the site also, heart.org. Make sure that people know to look there for information about their health, for their loved ones, and for themselves. Really important information. Always love speaking to Damon. He keeps it real and gives you actionable advice every time. So, all right, here we go. The judges have made their decisions. The fan favorite has been tabulated. Judges, are you ready? We are going to start with our second place $10,000 grantee. Shelly, take it away.
Oh my goodness, Sharon, this is an amazing night. Definitely it was a challenge for us to have to make this decision. It was awesome hearing all the stories this evening. All the participants have amazing companies with potential for immense impact on communities. And so I'm so excited to even just say that I was a part of hearing these stories. Okay, so I have the pleasure of announcing the second place grant recipient. We chose this recipient because we see this effort as an opportunity to scale access to a new career path while literally saving lives. And so I'm excited to announce that the second place grant winner is Cornelia Williams with EMT Tomorrow.
Cornelia, you're on mute.
You're on mute. It's
okay. So sorry. So shocked, but so excited. I can't thank the American Heart Association enough. It's really going to have a huge impact on our ability to provide all the accessibility measures for our program and just, make the program thrive. So thank you again. I don't know how else to say thank you, but I appreciate that.
Congratulations. I'm excited to see what you do next.
Thanks.
Oh, I'm sorry. And up next, I'm going to pass it over to Dr. Jimenez to make the next announcement.
Thank you so much. I just want to echo what Shelly had shared, that the innovation of all of these projects was just absolutely phenomenal. And all of these businesses are going to be making really important change. So thank you. Our top winner tonight was chosen as the judge's favorite because of the exciting innovation of their proposal and the ability of their product to actively engage community members to manage their health. And the AHA believes deeply in meeting people where they're at. And the innovation of this business allows everyone to learn how to manage their own symptoms, to know their bodies, and to receive tailored guidance on what they need when they discuss with their healthcare providers. So in the spirit of the Empowered to Serve Award, this business fundamentally works to empower its community. Alfred, do you want to announce the winner?
Yes, it's my pleasure to announce the winner. And I got to say, this was a very, very hard competition to judge because every one of these businesses were on point with tough problems that we need to get solved. But our winner not only made the case for impacting healthcare outcomes in a way that really broadly impacts society, but it was really a great, solid business concept, using words and following trends in the marketplace like wearable tech and using Wi-Fi and Bluetooth and scalable. And my favorite, ambulatory personalized monitoring. You can't talk like that and not get me excited. So without further ado, we present our top grant to Sharon Samjit of Healthcare Originals. It was an amazing pitch, an amazing business. Congratulations.
Oh, thank you so much. I'm going to try not to weep. This was a fantastic experience. Thank you, the American Heart Association, the judges. Thank you for the HCO team. I was the face of this, but we don't do anything without a fabulous team. My amazing husband and everyone back home. Thank you for all the exciting voting. I am almost speechless, but thank you so much. This means a lot, and we are just looking forward to helping people in the community. Thank you.
Well, congratulations again, Sharon. Congratulations to everyone that pitched, but congratulations again, Sharon. We're expecting great things from you and from Healthcare Originals. Now it's my pleasure to pass it on to my judging colleague, Prathamesh, who is going to tell us who is the fan favorite award winner. I can't wait to find out who that is, because that's almost as tough as our judging to pick that one, but we'll see what happens.
Thank you so much, Alfred. This was a very difficult competition to judge, and all of you guys were so close. The fan favorite award goes to Kimberly Brown. Kimberly?
Oh, wow. Oh my gosh.
Now you have to sing a song for us.
Do it for the sake of your heart. Oh my goodness. Thank you so much to the American Heart Association, to my husband, to my family, to all the supporters, to those that voted tirelessly daily, to everyone everywhere that supported Get Up, Get Moving. Thank you so much, and especially to the judges and Miss Krista. I'm super, super excited, y'all.
You should be. We're
Thank
excited
you.
for you. We're excited for you, Kimberly. Congratulations.
Thank you to God. I'm in the church right now.
Absolutely. Absolutely.
Yes.
Congratulations to Cornelia as well. And congratulations to you, Sharon, for being the top winner tonight. Of course, every grantee, everyone who was in this competition is a winner. Even if you did not become a grantee tonight, we know that you will in the future, and some of you already have in the past as well. And so we congratulate all of you. And I want to thank all of you for joining us today. You know, lending your time, your attention to what is happening here with the American Heart Association, this unique business accelerator program. There are a lot of pitch competitions out there, but having this organization lead the charge to come up with innovative new technologies and new preventative measures for healthcare disparities across the country, it is a tremendous, tremendous effort of this organization and all that have participated. So please stay tuned for more information about the application period for the 2022 National Empowered to Serve, and share the information with the change makers that you know. I want to give a special thanks to our judges, to Alfred, to Monique, to Shelley, to Prathamesh for their support of the American Heart Association and the Empowered to Serve Business Accelerators. We also, of course, want to thank Damon John for sharing his entrepreneur expertise. And last but not least, we want to thank the late John R. Houston III for his support of the American Heart Association and the health equity work that this organization does. Mr. Houston was a longtime AHA advocate and donor, and at his request, the organization was able to fund the top grant of $50,000 for this year's Accelerator. As we honor his memory tonight, we know that this grant is part of his amazing dedication to the right for all people to have access to basic human rights, such as healthy food, housing, and healthcare. And congratulations once again to all of the grant recipients, to all of the candidates, to all of their teams and the work that they're doing. And most importantly, thank you to all of you for supporting the American Heart Association and the tremendous work that they are doing. I am Sharon Epperson. Have a very good night.